morning. My name is Ralf Friedrichs. I'm an author, an addiction recovery coach, a life coach, and the host of this show, the Take Your Life Back radio show, in combination with the video, a part of it on YouTube under Take Your Life Back Today show. Too many overdoses. Emergency room fight drugs with drugs amid opiate crisis. Opiates are the most addictive drug in the world, according to the new reports that are out. The opiate crisis within the United States continues to take center stage as the National Institute on Drug Abuse says more than 115 people die of opiate overdoses each and every day. And this was a couple of years ago, this survey, so it's probably a lot more than that now. It happens every day. Emergency clinic administers life-saving care to patients suffering from opiate overdoses. Now doctors, counselors, and agencies are considering anti-addiction drugs as first response in emergency rooms. Most emergency doctors want to expand such medication-assisted treatment, or MAT, according to American College of Emergency Physicians. It weighs on you driving home after a night shift and someone didn't make it, knowing society could have intervened and helped, said Bobby Redwood, an emergency and preventive medicine doctor. Medication-assisted treatment is a proven method for successfully treating substance abuse disorders by combining anti-craving medicines such as buprenorphine or methadone with supportive counseling and behavior therapy. Anti-addiction drugs such as buprenorphine and narcotic, also referred to subsequent, can diminish withdrawal symptoms for a patient in detox and otherwise uncomfortable and challenging experience. A lot of the work we're doing is figuring out what does a community need to become to be ready and medically assisted to help treatment, said Redwood, a former president of American College of Emergency Doctors. More overdoses than ever. More people died nationwide of drug overdoses in 2017 than ever before, a staggering 10% increase in deaths compared to 16. A high concentration of those deaths happened in mid-Atlantic states and Midwestern states. Midwest saw 35% increase in fatal opiate overdoses between 15 and 16. Emergency department visits for overdoses were highest in the nation, with an astounding 100% increase between 2016 and 2017, according to the Centers for Disease Control and Prevention. But tough obstacles and many miles often separate those suffering with opiate addiction from reaching outpatient programs that provide medication-assisted treatment for people or doctors that need to prescribe certain medication. For those that conquer and get to the ER, sometimes it's too late, but that's why we all feel that we need to intervene. Some people are asking for grants. One particular Midwestern state got $820,000, but that's really just a mere dent in the fight. In a landmark study in 2015, patients who started on buprenorphine out of the emergency room were twice as likely to stick with treatment and therefore twice as likely to avoid overdoses compared to those who received only references to local clinics. We need to start today. We need to work together. Call me at 844-405-HELP, because we can help each other take our lives back. Be good to yourselves and be good to each other. A simple smile to a total stranger can help them and can make a difference in your life. Folks, $813,000 in one state is not enough to fight opiate crisis. We need to get more funding. Let's go to our local